there a way to determine that damage is occurring to the nose from vasculitis early enough to stop further damage from happening?
Well, these are great questions. And, when you talk about ear, nose, throat, a lot of it has one thing in common. All of that has that respiratory epithelium, the first thing I mentioned. So that's why the GPA targets those areas. As a general rule, again, I like the fire analogy. Your question is, if the nose is on fire, the sooner you call in the fire brigade, the better off you'll be. So obviously early diagnosis is critical, or certainly very helpful. The sad reality is often people don't get a diagnosis until, sometimes it's years, and the hell that some people go through is terrible. And I don't judge anyone because, we talk about zebras. Most people don't think in those terms. The one thing I learned in internal medicine is that the most common diseases happen most commonly. So you always have to play your more common hand. So the question, I think, is, can this affect the nose? How do you find it early? Was that it? Just want to be sure I understood the question.
Yeah, it was, is there a way to determine that damage is occurring to the nose from vasculitis early enough to stop it from being so bad when many people are finding out? Could they have done probably?
Well, okay, so the question is, what does so bad mean? Does it mean a collapsed nose, a saddle nose deformity? Does it mean losing your septum? Is it crusting? Is it infection? Is losing your ability to smell? Is it bleeding? Is it disease that now goes to a contiguous structure, a structure that's next door, like the orbit, the eyeball, sometimes the brain from the sinuses? So the answer is, of course, sooner the better. And in theory, somebody will come to the doctor and say, my nose is blocked, it's congested. And if you do have systemic vasculitis, often it's not the most common or first thing on most doctors' mind, and rightfully so, because you take 100 people who present like that, 99% of them will not have vasculitis. So it's hard to say, what do you mean by how much like that? It could always be worse. And, I didn't bring clinical slides because I could show you sometimes some real horrors. And so I often tell people, as bad as it is, you'd be surprised how much worse it could be. One thing I noticed about, Mr. James and Ms. Haggard is they both have tracheotomies, talking about how worse it could be. And they seem to be doing very well with it. Seems one's happy leaving it, the other doesn't want to push it. And that's a completely reasonable and solved approach. And, I support their decision to make those, how those things affect their bodies. So if you want to go more into ears, we could talk about ear issues, sinus issues, nose issues. I'm not sure, because these are good segues.